Hi, everyone. Welcome to our presentation on the leading causes of mortality in Filipino Americans from the years 2010 to 2020. My name is Shiwa
Anytime
Chin.
you're ready, Team Chiquita.
Oh.
Should we
Hello,
start?
can you hear me?
Yes.
Okay. My name is Shiwa Chin. I graduated from Johns Hopkins University, and these are my team members, Rohan Datir from California North State University, and Nicholas Kakuda from UC Santa Barbara. To provide some background, the Philippines is a country in Southeast Asia consisting of thousands of beautiful islands and a culture in which socialization centering around food is a defining characteristic. Filipinos first came to the United States over 400 years ago, and they're the third largest Asian subgroup. Unfortunately, due to the consequence of the focus on lifestyle, Filipinos have a higher incidence of chronic diseases like obesity and diabetes. And to better understand their unique needs and the health disparities they face, we decided to study the leading causes of death among Filipinos, both those born in the Philippines and in the United States. To fill this gap, we hope to answer this question: what are the leading causes of death in Filipino Americans from 2010 to 2020 in comparison with non-Hispanic whites? We use two databases in our research, the first of which is the National Vital Statistics System, or the NVSS, that's provided by the CDC's National Center for Health Statistics that processes and stores data for natality and mortality. The mortality database processes death certificates provided by mortuary records and coroner reports, includes a number of demographic factors that can be used to categorize the deaths by cause and stratify by demography. And we took data specifically from these two sections of the death certificates, which contains the variables we wanted to examine, which are age grouping, sex, Hispanic origin, race, and whether the decedent was born in the United States, as well as the immediate cause of death. The second database we use is the American Community Survey, or the ACS, and that's conducted by the US Census Bureau to provide population metrics to help determine how resources are allocated. It contains sample data that's used to extrapolate to the overall population of the United States. The ACS includes standard errors, but measures the population, including demographic measures in years that the census is not conducted, and it includes standard errors to account for any uncertainty. For our methods, we used and cleaned data from both databases. We first removed Hispanics, people with an unknown cause of death, and people who are not white or Filipino, and then stratified by race, age group, nativity, cause of death, and sex to find the leading causes of death in Filipino Americans. We then calculated crude mortality rates that we subsequently adjusted to the total population according to the ACS.
So this led us to the 10 leading causes of death in Filipino Americans. The 3 leading causes of cancer, ischemic heart disease, and cerebrovascular disease were the same in both Filipino Americans and non-Hispanic whites, and they accounted for over 48% of mortality in Filipinos. Of these causes, the notable differences in rank were diabetes and Alzheimer's. Diabetes was comparatively higher in Filipino Americans than non-Hispanic whites, while Alzheimer's was much lower. We also grouped the 10 leading causes by mortality percentage relative to the total from the 10 leading causes. From this, it is clear that there are definitive differences when accounting for nativity and sex, and these factors should be studied. We also found the overall age-adjusted mortality rates for both Filipino Americans and non-Hispanic whites prior to stratifying by race and nativity. So across almost all of the causes of death, non-Hispanic whites had the highest rates, with non-native Filipinos in close second. We compiled the data in bar graphs, separating age-adjusted mortality rates first by race, then by sex, then by nativity for Filipinos. And then we got 6 bars from left to right. Filipino females that are US born, then non-US born, Filipino males that are US born, then non-US born, then white females and white males. When we stratified the leading causes of mortality, there were 4 notable findings. First was in cerebrovascular disease, where we noticed that non-US born Filipinos had around 1.7 times the risk compared to their native counterparts. Second was in diabetes, where we found non-US born Filipinos had around 1.5 times the risk compared to their native counterparts, and with non-native males even having a higher risk than white males. Third was in flu and pneumonia, where the non-US born Filipinos had 1.5 times the risk as native Filipinos. Fourth was in suicide, where native Filipino males actually had a higher rate than non-native males and had double the rate of suicide as the general population.
So as for some key takeaways, there's a clear distinction of mortality in Filipino Americans and non-Hispanic whites based on the leading causes of death not being consistent. This distinction can be further seen in the stratifications of the Filipino American population by sex and nativity. From these stratifications, we found the disparities in cerebrovascular disease, diabetes, suicide, and pneumonia. The disparities in cerebrovascular disease and diabetes could be from a number of causes, but are likely due to a combination of genetic and social factors that are associated with the lifestyle of Filipinos, like smoking, drinking, and diet. The irregularity in suicide that has native Filipino males at a higher adjusted mortality rate of suicide than non-native Filipino males is a likely indicator of social factors that come from being born and raised in the US. Furthermore, the trend in flu and pneumonia category of non-native Filipino males exceeding the adjusted mortality rate of non-Hispanic whites could be from a number of sociocultural or economic factors that make non-native Filipinos more prone to the flu and pneumonia. Moving forward, from our results, it's clearly important to study the trends in Filipino mortality because of its significant difference from the non-Hispanic white mortality. It is also important to stratify the minority population by variables like sex and nativity in order to gather the full picture. Based on the age-adjusted mortality rates, more resources need to be put into Filipino American health to help them lead healthier lifestyles, both mentally and physically. Public health interventions in the form of education programs targeting non-native Filipinos for diet, exercise, and immunology could possibly lead to lowered rates of cerebrovascular disease, diabetes, and flu and pneumonia. More resources could also be allocated to supporting the native male mental health population to lower the rate of suicide as well. Some limitations for our study included the ACS as a population sampling dataset rather than the census that is raw population data, as well as the fact that multiracial people had to be excluded from the study because of the nature of the survey questions. Lastly, there are likely instances of misclassifications of the causes of death. As for our next steps, we will be continuing to build upon our research through some additional data analysis and gathering. We will eventually find age-adjusted rates through the years of the study to see how everything trends beyond percent mortality. To finish our statistical analysis with the ACS and NVSS databases, we will likely switch to use the ICD-10 codes instead of the UCR39 codes for the causes of death in order to create more specific groups that we have more control over. Lastly, we hope to gather the data from the database that the Philippines has on mortality so that we can get a better understanding of the possible genetic and social factors that can contribute to any difference between Filipino mortality in the United States and Filipino mortality in the Philippines. Thank you for listening to our presentation, and we'd be more than happy to take any questions you may have.